Very well put. So that's basically what we're going to speak about today. So I'll just share my screen. Okay. So today we're going to speak about what is a good research question? Why do we need a good research question? What are the very, very basic types of research? And when we are talking about experimental research, what is the concept of PICOT? Now, there are two, basically, my screen is visible, right?
It's visible, sir.
So there are two groups of individuals. One are the clinicians, and the second one are the researchers. They're two quite different sorts of individuals. So the clinicians work in the practice. So they are at a university, a private clinic, a government setup, and the researchers are sitting in their offices and trying to come up with solutions to common problems. Now, if the clinician does not know what the problem is, then he cannot put forth a question which can be answered by research. And if the researcher does not do his or her work, then they cannot come up with evidence so that the clinician can use it in their daily practice. So this is a cycle that we require in our practice so that we can evolve ourselves through sound scientific knowledge or evidence-based medicine. Okay. So when a researcher or when a clinician, for example, a lot of postgraduates are into their thesis and they do a lot of research. So when you go to a statistician or when you go to a researcher, they ask you, what are you trying to answer? Okay, so what is your research question going to be? Okay, so anybody who is present right now, I think about 8 or 9 of you are there. Anybody wants to tell me what your dissertation or thesis topic is and what is your research question? Anybody? I mean, it's not going to I'm not here to judge you. I'm not here to do anything else. I just want to know what are the relevant topics which are being used right now. You can put it in the chat box if you don't want to unmute yourself. Dr. Deependra, are you around? Okay, we have one. If anybody else wants to type in, you can just type it in so that I can have an idea about what we need to talk about. Okay, so Neha has put up a very relevant topic, that is acromioclavicular joint treatment modalities. Okay, so as a research question, what do you want to ask, Neha? You can unmute yourself and answer. What do you want to ask yourself?
Sir.
Yes.
Am I audible?
Yes, you are audible.
Good evening, sir.
Good evening. Tell me.
So my research topic is on functional and clinical outcomes of tibialis anterior tendon transfer for recurrent clubfoot.
Yeah, functional and
clinical.
Okay. Outcomes.
Yes.
Of or for
tibialis anterior tendon transfer for recurrent clubfoot.
Okay. So this is one research question that we have. We have another research question by Dr. Neha, who wrote about AC joint treatment modalities. Okay, so she meant AC joint dislocation treatment modalities. Let's just make sure we don't have anybody else. PRP versus placebo in treatment of early ONE. So we have PRP versus placebo in treatment of early ONE. And I think we have one more, that is PRP and steroids in plantar fasciitis. Okay, so number 4. Okay, this is enough. Please don't write anymore. Okay, so out of these, we have AC joint dislocation treatment modalities, which is basically going to be a descriptive. It's a description of the different types of treatments that are present. So this is not going to be a study. You're just going to do different types of treatment. So you can either do you can do a arthroscopic repair. You can do say a K-wire fixation. You can do a hook plate, or you can do a excision. So you can do all of these, and these are different types of treatment modalities. So you are describing the different types of treatment modalities which are present with AC joint, and you're telling that you have done this in 20% of cases, this in 30% of cases, and in the end you can tell that how the functional outcomes were in those patients, but you're not comparing them with each other, you are just telling them. So this becomes a descriptive study. Okay, so this becomes a descriptive study. You're describing. Okay, the others, functional and clinical outcomes for tibialis anterior tendon transfer for recurrent club foot. So here again, you are not comparing with anything. Okay, you are not experimenting. You are not comparing two different things. You're not seeing how they are going to change the treatment, but you are just following up a single population, that is children with recurrent clubfoot who were treated with tibialis anterior tendon transfer, and after a particular time point you are going to do a functional analysis or functional outcome, and you're going to do a clinical outcome. So basically both of them are going to be more or less the same. Both functional and clinical outcomes are going to be the same. So you're not going to compare it with a different. Yes, tell me.
Sir, if I may. So I'm designing the study to make it a retrospective cohort study. I have a comparison group. So my comparison group is going to be those patients with recurrent clubfoot who didn't underwent the procedure.
Okay. Okay. So I will I think I will take your question in the end. Okay. Remind me if I do not. Okay. But as this question stands, this will be a descriptive study, very similar to what Dr. Neha's topic is, that is about modalities of treatment, because you're going to describe them if it is prospective. Okay. So then come the last two, that's number 3 and number 4, where we are having PRP versus placebo or PRP versus steroids in the treatment of a particular disease. Okay, these are comparable comparative studies, or these are going to be interventional studies where you're going to intervene and tell how much benefit or how much loss was there with these particular problems. Okay, so the 3 different types of studies are going to be, or 3 different types of research questions are going to be: descriptive, relational, where you're telling that these 2 causes are related to each other, like smoking and non-union would be a relational study. And the third one is comparative, where you are comparing 2 different groups or 2 different variables for a disease. Okay, so your types of research questions are going to be descriptive, relational, or comparative. Okay.